Hey everyone, my name is Colin. I'm currently a second-year graduate student in the MSTP program, and with me today I have the honor of talking with Dr. James Willig a little bit about our clinical skills and what's getting changed in the clinics realm. Dr. Willig, how are you doing today?
Doing great. Thanks for talking to me today, Colin.
I appreciate it. So I know I'm a year or two away from re-entering the clinics, but tell me, what am I going to expect? I heard there's some new changes with these entrustable professional activities.
So let's talk about that a little bit. So entrustable professional activities, or EPAs, come from an initiative from the AAMC, where basically if we can define a set of objectives that all graduating students should know, regardless of the specialty they're coming into. One of them is to learn a full history and physical examination. To get one on the wards, it takes us a long time to do a full history and physical examination. We're a second year, and it turns out that to observe it, it's difficult for the clinicians. So what we've tried to do is we've tried to cut it into a lot of small bite-sized chunks. Some of them are some parts of history takings, physical exam, usually by organ system, so that folks can go to the bedside and just kind of have people observe for that 5-7 minute chunk. So in the back of our minds, we're using some principles from educational theory in terms of we want to have multiple low stakes formative assessments. This is not going to be a part of your grade. This is actually like, come and learn, come and do these. And sometimes people are find a little bit daunting to talk to, like ask an attending or ask a resident to do this. But please keep in the back of your mind that all these people are teaching for a reason. So let me show you a little bit about how we're doing with EPA so far this year. So you can see in this is about month 3-4 of the year, we have done 745 EPAs, and you can see the distribution of how many require direct supervision, that really is a learner early in their learning curve, how many require indirect supervision where we see some areas of strengths and some areas that need some focus, and how many really are performing at the independent level where the evaluator was like, yeah, you got this. These are the curves we want to see. May was one of those rotations where we have very experienced students and novice students, but if you look from June on, you can see that we start down at 2.6, and then gradually we see the growth in our students. And you can see this across our campuses as well. And these are the curves as they should be. These are people learning. Again, there is no bad grade. There is no, this doesn't impact you. This is literally like, get better. Come and get your feedback.
Yeah, awesome. No, because I mean, I'm for sure when I re-enter the clinics, it's going to be in that need direct supervision. So it's comforting to know that this is really more just like to make me a better student than to say like, oh, you're going to get just a pass or potentially fail. It's truly just about how can you be a better clinical student. And I think, those numbers, right? 745, correct?
So far.
That's incredible. And that just goes to attest, I think, how faculty are buying into this. And like you said, sometimes students, we put attendings, we look up to you guys, right? So we put you on pedestals, and it can be nerve-wracking to ask for the feedback. But like you mentioned, I think attendings are really wanting to teach students, and those numbers just speak to that fact, I believe, at least.
And one thing that I would tell our learners is please be patient. Remember that we're a generation that wasn't trained with thoughts like low stakes formative assessments are going to make people better. That's kind of newer stuff in the educational literature as applies to clinical skills development. So I think the attendings also have a learning curve. This is more EPAs than we saw the first year we did this program, and it's just a couple of months. So for us, it's incredibly encouraging. We feel that we're in the middle of a culture shift. And when this culture shift will ultimately complete is when folks like you are the residents and the attendings, and you know the value of this, the impact it had on your development, and you'll help others get the same.
That's awesome. That's awesome. So speaking of assessments, I also heard that we're bringing some OSCEs back to the clinical years. They're normally just in the preclinical time, but now we're going to experience them in our clinical years. And there's also like this 3-point check-in process with it, from my understanding.
Yeah, no, thank you for asking. So this is the thought process behind this is a lot of schools will have an OSCE at the end of the third year. We did a lot of work and a lot of sort of one-on-one discussion with students who previously failed the step to CS. And we found that there were some students that were making it halfway into the fourth year or further, and their clinical skills development and their ability to apply clinical reasoning to cases wasn't as developed as it should have been. I've asked these students honestly, like, how did you get through all the rotations like this? And sometimes they hung back, they read other people's notes before they wrote their own. There's a lot of factors agreeing with it. And I think it's sometimes we worry so much about the score we are going to get in that rotation that we miss the bigger picture, that these are the skills that are going to allow you to take care of people for the rest of your life. So it's interesting that some of those students would, in a sense, had won every battle, had honored every clerkship, but had failed sort of this assessment because they'd done the things to pass the class. They hadn't done the things that to develop their own skill set to make them independent, ready for independent practice. So rather than viewing one assessment at the end of the year, part of what we want to do is we want to be able to detect where people are during the year. So think of our three-point check-in strategy as 12 stations divided into 3 groups of 4. So we'll do one in every third of the year, and then we will hopefully provide some direct feedback to the student from their clinical skills scholar from before, who they have already an existing relationship with, to kind of say, hey, here's where you are, here's what I think we can do to improve, and maybe have the opportunity to create individualized plans for the student to focus on areas where they need a little bit more growth, rather than giving you a grade at the end of the year, which is great, but that's not what this is about. This is about learning to do the job, which will allow you to take care of people your whole life, and frankly, be your profession. We got to do better. We got to provide you feedback as you're going in the journey, bringing some of this ideas from the OSCE, from the EPAs into the OSCE. So the 3-point check in OSCE begins this year. This is what we call a formative year with our partners in the Office of Standardized Patient Experience with ICM. We are crafting this and polishing and fine-tuning it. And we hope that one day we'll move it up to be a summative assessment where we can actually have a score at the end of the year. But we have to sort of validate our strategy and get some good data so that we can put a proper assessment there. But that's our long-term view. And our intent is you got to know. You got to know early in the third year when you got time to do what you got to do to get better. You don't want to know 6 months from graduation when you're staring at July 1st. I'm an intern on that service. That's we got to prepare you for that.
Oh, absolutely, man. I would not want to have to be in the shoes of being like, well, I do not know how to be a doctor. I'm going to be a doctor in 6 months. And, with step 2 CS being canceled, I mean, let me tell you, students aren't upset about not having to pay for that wicked expensive lunch. But I think this is a much better way of being able to say, hey, you're on the right track. You're ready to go see patients on your own. And I think this will be a really positive impact for students in their clinical years.
Good feedback is the difference. It makes a marked difference in our developmental curves. And it's tough to get that feedback in the clinical years in a high moving, rapidly flowing clinical environment. So these are all some of our attempts to try to get that feedback to students, because this is how we get better. We got to hear we're unpolished here. None of these things are designed to give anybody a pat on the back. They're designed for, let's get some real talk about where we are, because that's how we improve. Absolutely.
Could not agree more. Well, Dr. Willig, I know you're a busy man, so thank you for taking some time to talk with me about this today. I greatly appreciate it.
Thank you. Appreciate what the students are doing.
Thank you.